Thank you very much. My amendment addresses health savings accounts. Health savings accounts, they work. They lower cost. They're patient-centered. They belong to the patient. They incentivize healthy spending. For example, Kaiser Family Foundation, kind of a left-of-center think tank, did a study, and they found that a family of four with a health savings account and a catastrophic policy on top had cost of 30% less than a family of four with traditional insurance. They also found that this family of four with a HSA and catastrophic policy just as frequently accessed preventive services as a family of four with the traditional insurance policy. Now, they also found that 27% of people who have an HSA with a catastrophic policy were previously uninsured. About 50% have family incomes of $50,000 or less. So clearly, by involving patients in their health care, it lowers costs, expands access to high-quality care. It would be kind of a nice cornerstone for reform. That said, this bill does not explicitly exclude high-deductible health plans with an HSA, but it does not specifically protect them either. And frankly, those people out there who we hear chanting, trying to have their voices heard, are afraid that there is mischief in this bill beyond what they can see there. So the fact that it leaves the door open, if you will, for removing access to these to the future, I think is of concern. Now, that said, this amendment ensures that the 8 million that are currently enrolled with a high-deductible health plan and HSA will be allowed to keep their current plan by deeming those plans adequate coverage. Furthermore, any standards adopted by the Secretary, I'll never again say deeming without smiling, I have to admit, so it's become so totally different to me now. Furthermore, any new standards adopted by the Secretary shall not apply to high-deductible health plans and health savings accounts if such standards would have the effect of disqualifying such plans from meeting the essential benefit package requirements. I think it also does one more thing. It just establishes that if Americans are responsible, and most Americans are, they have freedom to decide what they will purchase with their dollar. And so health savings accounts, which are basically a bank account, which if you don't spend rolls over, and Mr. Hastings, you'll love it. Insurance companies have no role other than to provide access to PPO pricing, if you will. So the individual controls it, not the insurance company, which is their power. It cuts out that administrative cost that insurance companies have. And instead, it allows a direct transaction between the consumer and the person providing the care. So again, this bill, I ask for its approval. Any questions?